What are some of the challenges in detecting MRD in localized colon cancer patients with stage 2 and stage 3 colon cancer? After curative intent surgery, all stage 3 colon cancer patients undergo chemotherapy. However, we know that half of these patients are already cured by surgery alone, so we are overtreating 50% of stage 3 colon cancer patients. On the other side, we know that stage 2 colon cancer patients receive adjuvant chemo based on clinical pathological characteristics of high risk. However, 20% of these patients will relapse, so we are undertreating 20% of stage 2 colon cancer patients. Therefore, it is a clinical need to know whether the patient is cured after surgery and whether the patient should need adjuvant chemotherapy to avoid relapse. How can the Guardant Reveal test help clinicians with treatment guidance for patients with early-stage colon cancer? Guardant Reveal is a non-invasive blood test for circulating tumor DNA, which can detect minimal residual disease after curative intent treatment in patients with early-stage colon cancer. One of the advantages of using the Guardant Reveal test is that you do not need tissue, and with only a blood extraction, you can have information on whether there is ctDNA in the blood of that specific patient after a curative surgery. These technologies are technically more challenging. However, they have the advantage of being faster because you do not need to sequence the tissue and then the blood. This makes the turnaround time of Guardant Reveal tests much faster than tissue-informed tests. To reach sufficient sensitivity and specificity, the Guardant Reveal test uses a very smart strategy where both genomic and epigenomic signatures of specific cancer types are analyzed. Based on this information, Reveal test gives you a test result of whether there is or there is not presence of ctDNA. This information is what's useful for the clinicians for treatment management of patients with early-stage colon cancer.